So how do you give mouth-to-mouth resuscitation? Howdy, I'm Kiram, Chief Medical Officer at Polaris. This is CPR for Dummies. Wait. CPR for Noobs. I'm gonna give you some tips right now on how to save lives. Let's do it. Okay, so mouth-to-mouth, rescue breaths, ventilations, positive pressure ventilations. It's called a lot of different things. The idea is you're pinching somebody's nose, you're putting their lips over their lips, making a seal, all right, and you breathe in, okay? And to help make the flow better, you do a head tilt and a chin lift, like this. So tilt and lift, help open up the airway a bit, pinch the nose, cover, do a breath. All right, that in essence is mouth-to-mouth resuscitation. And remember that resuscitate means bring back to life, right? So we're hoping to resuscitate them by breathing for them. Now, there's a few things to consider about this. One, if you're going, skin to skin like this, if they have any diseases in their saliva, you could get them. So, you have to consult with yourself if you're willing to take that risk to help somebody. You can avoid all that by having a barrier device like this, okay? This goes right over, no problem. You do need to make sure you've got a nice tight seal, okay? So that no air escapes. And then you give that breath, okay? And when you give that breath, whether it's with the barrier device or skin to skin, you will see some chest rise, okay? Maybe just a centimeter, it's hard to say, but the chest rise confirms that you're doing it right, all right? So, okay, well, how many breaths do you give? When you're doing CPR, you're gonna do 30 chest compressions and then 2 breaths, and you do that back and forth continuously. That's CPR, is 30 compressions, 2 breaths, repeat forever, okay? That's how that works. And there's another circumstance where you can do mouth-to-mouth resuscitation, rescue breaths, okay? And that would be in not a CPR situation. It's gonna be just the rescue breaths. So think about someone who overdosed on drugs, okay, was poisoned, maybe low blood sugar, okay, maybe drank too much and is unconscious. You've got someone who could be conscious or unconscious. They have a pulse, so they're not going to get CPR, but they're not breathing adequately. They're actually not breathing enough, okay? And that's very bad for them, right? Because the brain needs oxygen. So for these people, okay, we can give them rescue breaths, but we're not just going to do the 2 breaths, right? The 2 breaths is strictly for CPR. For these people who have a pulse, but they're not breathing adequately or not breathing at all, we're going to do 10 to 12 breaths per minute, which is 1 every 5 to 6 seconds. So you do 1 breath, you wait 5 seconds, next breath. And when you do a breath, whether it's during CPR or like this, you do it over 1 second. You don't blast the person. It's just a nice, smooth flow. And then, so what I'm describing there is doing rescue breaths for a non-CPR situation, right? Like I said, overdose, poisoning, unconscious, concussion, whatever it is, you do those breaths 1 every 5 to 6 seconds forever, until help arrives, basically, because you're going to be doing their breathing for them at that point, so you're committed. So just do that, and that would be rescue breaths in that situation. And then we have rescue breaths in CPR where you do 30 compressions and the 2 breaths.